Good morning, everybody. Immigration, family reunification, and where we are and where we're going, according to Ahmed Hussen. First, I want to find out where we were. And this is the March 2014 evaluation of the Family Reunification Program. So this was under Stephen Harper, and link is in the description. You can read it all for yourself. The first thing and the most important thing is just getting an idea of how this program works and eligibility, etc. It says to be eligible to sponsor under either category of the program, a person must be a Canadian citizen or permanent resident, at least 18 years of age, and reside in Canada. Canadian citizens who reside outside Canada may only sponsor spouses, partners, and dependent children if they will reside in Canada as a sponsor when their relative becomes a permanent resident. In order to be assessed, all prospective sponsors are required to submit a joint application, including an application to sponsorship agreement, an undertaking signed by the sponsor and the sponsored family member who simultaneously submit a signed application for permanent residence. The sponsorship agreement and undertaking represent the sponsor's legal agreement to financially support a sponsored person and their family member to repay any social assistance granted to the sponsored person during a period of 3 to 10 years, depending on the type of familial relationship. Should the sponsored person receive social assistance during the period of the undertaking, the sponsor is considered to be in default of their agreement, and the sponsor must pay back the funds received by the sponsored person to the respective province. Sponsors are prevented from sponsoring another relative until such funds are repaid in all. So this is serious stuff. They expect you to take care of the people that you're sponsoring, and they are not joking about that. So I wanted to show you parents and grandparents are the class that we're talking about, and I wanted to show you some specific things in the 2014 report with regards to the parents and grandparents. Here are final outcomes, and these are the overview at the beginning of the document. It goes much more in depth further into the document, but I wanted to show you. It says final outcomes. Economic outcomes of parents and grandparents are well below the average of all immigrants, with fewer than half reporting employment income, low average earnings, and increased employment insurance usage over time. Family class immigrants have a disproportionately high rate of reporting social assistance when compared to all immigrants, which can be attributed primarily to parents and grandparents. The sponsored undertaking is somewhat effective at controlling use of social assistance for parents and grandparents, while spouses and partners' use of social assistance appear to be influenced by other factors. Sorry, that's included. And I wanted to note all of this. This is important information. And the last thing, it says efficiency and economy. Budget allocations for the Family Reunification Program will decrease over the next few years, while planned FC levels targets are growing and will include a higher proportion of parent and grandparent applications, which have been increasingly costly to process. So this is where we were at in 2014. Here's the Liberal election platform. It says reuniting families. And again, the link is in the description. It says, quote, "We will make it easier for immigrants to build successful lives in Canada and contribute to economic success of all Canadians. Immigration has always been an important part of Canada's economic growth, but over the past decade, Stephen Harper has turned his back on welcoming those who want to contribute to our country's success. We will take immediate steps to reopen Canada's doors and will make reuniting family a top priority. We will immediately double the number of applicants allowed for parents and grandparents to 10,000 each year. We will also nearly double the budget for processing family class sponsorship. Wait times will come down, which currently average almost 4 years for parent and grandparent applications. We will provide more opportunities for applicants who have Canadian siblings by giving additional points under the express entry system, and we will restore the maximum age for dependents to 22 from 19 to allow more Canadians to bring their children to Canada. Their 22-year-old children to Canada, right? They're 22-year-old children. Back to the article. We will also grant immediate permanent residency to new spouses entering Canada, eliminating the 2-year waiting period. That was the promise. Here is today, and we'll look at Ahmed Hussen's thread, but CBC News is reporting, actually this is yesterday, CBC News is reporting, quote, online applications to sponsor family immigrants hit limit in less than 11 minutes. First come, first served online system replaced controversial lottery for 2019 program. It took just minutes today for people to snap up 27,000 online application spots for bringing parents and grandparents to the country, fueling frustration and fury among people who say the new system is flawed and unfair. I'm one of those people. It's flawed and unfair. Oh, not for the same reason the people are mad. Oh, I get it. Sorry, back to the article. At noon Eastern Time today, Immigration, Refugees, and Citizenship Canada opened up to applicants its online form for indicating interest in sponsoring a family member through the 2019 Parent and Grandparent Program. Just 11 minutes later, the department tweeted that the applications received had met the annual limit and the form had been closed to new applicants. Here's the IRCC tweet. It says, quote, "The interest to sponsor form for the 2019 Parent and Grandparent Program is now closed. If you successfully submitted the form, you should receive an email within 24 hours confirming we received it. Find out what happens next." A flood of angry complaints followed from frustrated would-be applicants, many of whom said they'd cleared their schedules and set up their computers to fill out the online form, only to find it shut down within minutes. "This is not a concert ticket you're selling. This is about uniting families. The whole process is atrocious," wrote Naimul Khan on Twitter. Some called for an independent audit of IRCC's sponsorship process. "Yeah, I didn't get in, so it must have been wrong. It must have been flawed. It's messed up. Let's check it. Possible legal action." I scroll down. Matthew Genest, spokesman for Immigration Minister Ahmed Hussen, said the department's initial analysis indicates that there were no technical glitches. "We understand that those who were not able to make a submission are disappointed. We can confirm over 100,000 individuals attempted to access the interest to sponsor form," he said. "Family reunification is a, quote, pillar of the Liberal immigration policy," Genest said, noting that the government increased the intake of applicants to 20,000 from the previous 5. So under the Conservatives, it was 5,000 applicants, and they were saying that these applicants put a disproportionately high rate of reporting social assistance when compared to other immigrants, right? So, which can be attributed to primarily to parents and grandparents. The class that they're importing uses more money, and they're importing 4 times as many as the Harper government did. And the Harper government was winding the program down. Back to the article. "The online system was created to ensure the process was fair and had safeguards to prevent abuse," he said. The Liberal government scrapped its controversial lottery system for reuniting immigrant families and adopted a first-come, first-served online system after an angry backlash from would-be sponsors. Under the Family Reunification Program, about 20,500 parents and grandparents will be admitted to Canada in 2019 and 21,000 next year. Wow. Here's a thread by Ahmed Hussen talking about the whole thing. Thread. "Our government is committed to family reunification, which is why we increased the intake of parents and grandparents applicants from 5,000 under the Conservatives to 20,000 this year. Here's how we have improved the program." And there's a graphic here, and it says, "To help reunite more families in Canada, we are accepting even more applicants to sponsor parents and grandparents," right? 5,000, 10,000, 17,000, 20,000. And they know this information too. This is a Government of Canada report, right? Like they read this, or they were given this. Whether they read it or not is, well, who knows? But they knew about this. This is not something that is published in some minor magazine. The government had that information and used it for the Conservatives to make a choice, and that choice was to bring that number down. And the Liberals said, "Bring them in, bring them all in." Back to Ahmed Hussen's thread. Conservatives created a backlog of 167,000 plus cases, grew average wait times to 7 years, and then shut down the program for years. We reduced the backlog by 85% and cut the wait times to under 24 months. Did you just tell them all to come over to from Roxham Road? Is that no? Oh. Back to Ahmed Hussen. "The previous application process favored those who could afford expensive couriers. We moved to a random selection process. After hearing directly from Canadians, we implemented a first-come, first-served online system to ensure it was fair and created safeguards against abuse. We can confirm a preliminary analysis. There were no technical issues today, and we've received the maximum number of submissions for 2019. Interest in the program will always be very high. More than 100,000 individuals attempted to access the interest to sponsor form. We remain committed to reuniting families with loved ones and will continue to ensure client service remains at the center of all of our programs. For those who are unsuccessful in their application, your parents and grandparents can apply for a super visa to stay in Canada for up to 2 years at a time. Learn more here." And I looked quickly at the super visa program. It's essentially the same thing. They need to sponsor these people, and here's the criteria. To be eligible for a super visa, you must be the parent or grandparent of a Canadian citizen or a permanent resident of Canada, have a signed letter from the child or grandchild who invites you to Canada that includes the duration of the visit and how many people in the household, and a copy of that person's Canadian citizenship. They must have medical insurance, and it must be from Canada, from a Canadian insurance company, and they must have medical. They must have proof that the insurance has been paid, and there are some other criteria as well. So this is very similar to the program that they just admitted 20,000 people to. So that's one class that we looked at the beginning that the government of Canada clearly says cost more than other classes of immigrants coming into the country. Here is another one. CBC reporting April 16th, 2018, quote, Liberals loosen rules that exclude immigrants on medical grounds. And it says, quote, the Liberal government is loosening the rules that deem some prospective immigrants inadmissible on medical grounds. Immigration Minister Ahmed Hussen said the medical inadmissibility policy, which has been in place for more than 40 years, is, quote, way out of date and not in line with Canadian values or government policies of inclusion. Under the revised policy, newcomers won't be denied permanent residency if they or any of their children have developmental delays, special education requirements, or a hearing or visual impairment. The anticipated healthcare cost threshold, the sum of a prospective immigrant can't exceed in annual healthcare costs in order to be admissible, will increase to about $20,000 a year, about 3 times the previous threshold. Admissibility determinations are based currently on whether an immigrant's anticipated costs are expected to exceed the average Canadian per capita cost of health or social services over a 5-year period, or whether the immigrant could add to an existing waiting list and delay health care for Canadian citizens or permanent residences. Hussen said he estimates that new rules will allow entry to about 75% of the approximately 1,000 people previously rejected on medical grounds for excessive demand. More consultation and study will be undertaken, he said, with the goal of eventually eliminating the medical inadmissibility policy entirely. The immigration minister said he could not say if provinces and territories would be compensated for potential extra costs. So they're bringing in parents and grandparents, and they know that they cost more and access more. We are opening up the door for sick people to come in and tripling the cost. The cost was $6,000, more than tripling. The cost initially was $6,000, and now it's more than that, much more, $20,000. Here are 2 articles talking about increased healthcare strain from the Globe and Mail, first reported in February 2012 and then updated in November 2017. It says, quote, Canada's aging population will strain the healthcare system. This week's Statistics Canada is expected to reveal the demographic details of our aging country. It will spark more talk about possible changes to old age security benefits, but it should also help people ponder another social program under siege, Medicare. Canadians are living longer with more diseases. A growing number are developing multiple chronic medical conditions such as diabetes, high blood pressure, and kidney disease. Many of these are not sexy illnesses. You will never see the image of an arthritic hand on a hospital building as you see a heart. An estimated 16 million Canadians live with at least one chronic condition. They go from specialist to specialist and take several drugs. Some lack proper care until a medical crisis hits. Others are dubbed frequent flyers for their large number of emergency department visits. Not only is their care inefficient and inconvenient, it's costly. 1% of the population consumes about 50% of the cost of healthcare costs due to both hospitalization and home care. They also require higher proportional readmission to hospital, a matter of particular concern. Canada faces an enormous demographic shift. Sometime between 2015 and 2021, there will be more people aged 65 and older than those 14 and under. Some of these seniors will be spry and healthy, while others will have numerous medical problems. The aging demographic will be a test for Canada's healthcare system. It should be seen as an opportunity for a transformation in which innovations put patients first. Unless hospital and healthcare providers adapt, we will be doing a disservice to future generations. We are doing a disservice to future generations. Here's the Globe and Mail again. The boomer shift. Canada's healthcare system braces for hiking costs with influx of seniors. This was first reported in 2015, updated 2018. It says Canada's provinces and territories are under pressure to revamp their healthcare systems and rein in costs as baby boomers age. Seniors account for nearly half of the country's health spending, and that is expected to grow as the largest living generation in Canada becomes elderly. Quote, it's not sustainable how we fund healthcare. The types of increases that we have seen are much faster than tax growth, and with an aging population, it will only get worse, says Matthew Stewart, Associate Director of the Conference Board of Canada's National Forecast and Analysis Division. Canada spends an average of $6,000 a person on healthcare, with the highest cost skewed to newborns and seniors, according to Canadian Institute for Health Information. An average of $6,298 is spent on a person aged 65 to 69. The cost escalates to $11,557 for someone aged 75 to 79, and then jumps to $24,387 for someone aged 85 to 89, according to Health Institute's 2013 data. Costs right? Here's the chart. So if you think about that and think about the number increase from 5,000 to 20,000, right? Thank you, Mr. Hussen, for the fancy chart. And consider that they're letting in sick people. It seems like the plan is to flood us with very sick, very old people and not fix our healthcare very much because we're investing in people. I'm not sure exactly how that works. So now let's look at what's happening in our hospitals right now. This is May 25th, 2018, CBC reporting, hospital crowding, why all three major Ontario parties are promising more long-term care beds. For Nancy Parker, it began about 3 years ago when her husband, who suffered from complications from a previous heart attack, had to endure a 48-hour wait in the Ottawa Hospital emergency room before getting a bed. The following year at the Ottawa Heart Institute, her sister-in-law had her scheduled defibrillator implant surgery canceled because no recovery beds were available. She died at home 2 weeks later, the very day her surgery had been rescheduled for. The cause of her death was not known, but it was a terrible experience, Parker said. I scroll down. The Ottawa Hospital's average wait time for a bed isn't that bad, relatively speaking, just a couple of hours below the 16-hour average for all of Ontario. At Etobicoke General in Western Toronto, the average wait is 24 hours. In Greater Niagara, it's more than 40 hours. I scroll down again. Quote, "We don't use the word crisis lightly," said Natalie Mira, the executive director of Ontario Health Coalition, "but by every measure, our healthcare is in crisis. Regularly, we have people stacked on stretchers in hallways waiting for access to care. To be fair, every day, despite operating near or over full capacity levels, hospital staff save lives. People who are critically ill generally receive care within an appropriate time. But that may be cold comfort to patients like Jamie Lee Ball, who had to lie on a stretcher in the hallway of Brampton Civic Hospital's emergency room last year for 5 days waiting for a bed, or Leo Seguin, who was put in a bathroom last February in a Sudbury hospital for 10 days. In fact, many Ontarians have experienced firsthand the long waits in emergency rooms, and many more know someone who has. We are the worst and most expensive healthcare in the G7, everybody. Just know that. Here's a letter to the editor on January 12, 2019. Quote, "Hallway medicine, a killer," plus other letters to the editor. And I'm not going to read this letter out. This is a little... I just wanted you to see it. You can read it yourself. Link is in the description. Here's another one from the Toronto Star, July 3rd, 2018. "Hospitals failing senior retirement home, officials say." It says, "Officials from an East End retirement home say the residents are receiving poor quality care from the Scarborough and Rogue Hospital. In an unusual move, the officials contacted the Star because they said they wanted to publicly sound the alarm about their concerns. Seniors are not getting the care they need," said registered nurse Mary Kate Garrity, Director of Healthcare and Wellness at Scarborough Retirement Residence. "We have residents and families who say, 'Do not send me to Scarborough General, anywhere but Scarborough General,'" said Mary Josie LaFontaine, owner and executive director of the home on Markham Road near Kingston Road. Sorry, Miss LaFontaine, if I mispronounced your name. But this is not a crisis that is going away. By all measures, bringing in sick people and old people is a really, really bad idea. And especially, this is the last one I'll show you, since Canada has an aging population, we need to be bringing in young people, not old people. If we bring in old people, that doesn't help with our tax base, that doesn't help with our employment levels, that doesn't do what they're proposing the higher levels of immigration for, right? They're saying we need immigration for this purpose. We need to bring these people in for skills, but that's not what they're doing. And I understand family reunification is high priority, but at the same time, we need to make choices that are beneficial for Canada, not for people who want to bring their families to Canada. Sorry. Here's Ahmed Hussen, CBC reporting, January 24th, 2019. "Hussen unveils plan to attract, retain skilled immigrants in rural and remote regions." This is a whole quagmire in and of itself. "Plot aims to fill labor gaps as communities across Canada face youth exodus, aging populations." The Liberal government is launching a new pilot program aimed at attracting and retaining skilled immigrants in Canada's rural and northern communities, places that are grappling with labor gaps due to youth exodus and aging populations. Immigration Minister Ahmed Hussen announced the policy today in Sudbury, Ontario. About 78% of newcomers to Canada settle in big cities such as Toronto, Montreal, and Vancouver under the existing federal economic immigration program. Hussen said the pilot will encourage skilled workers and their families to set down roots in communities that need them the most. So we have hospitals that are in crisis all across the country. specifically in very heavily populated areas like Toronto and GTA, etc. Vancouver, I've heard horror stories as well. And Mr. Hussen is not putting the brakes on anything. He's pressing the gas. He's saying, let's go. Let's get more immigrants in there because we need to fill those labor gaps. There's a huge, huge problem. And it's going to come to a head. I hope it comes to a head in October. But the demographic shift, the speed at which this is happening, the absolute tone deafness of the Liberals to look at the actual data. They say they're a data-driven government. They are absolutely not, because the choices that they're making, unless their goal is to cost Canadians more money for healthcare, the choices that they're making will not improve Canadians' lives. Period. Period. That's it. Thank you very much for watching today. I appreciate your time. Check out the peoplespartyofcanada.ca. Have a wonderful, wonderful Monday. No, it's not Monday. It's Tuesday. Have a wonderful Tuesday.